Juan, the consultant, the RX consultant, and this is continue education as a pharmacist technician license that I have. So this right here, it is a blood vessel, right? And this right here is metoprolol. This is the molecular formula for metoprolol. And it interacts with the blood vessels in our heart that communicates to the nervous system. We have our brain here. And the person was saying, was taking Eliquis, which is trade name for this molecule right here. In the heart, we have different problems, right? We have arrhythmic problems, which means that we have different rhythm in our heart. That is not always constant. It happens to older people, and it happens to athletes, and it happens to young people. My youngest brother had a heart failure, which is different than AF, right? We got that clear. And then the question is whether to take this medication, which I already explained, is called Eliquis, with acetylsalicylic acid, which is trade name aspirin. But at the same time, he was telling me that he was previously on metoprolol. So there are two different situations. Eliquis, it is an anticoagulant. And aspirin is an anti-inflammatory. You get that, right? Anti-inflammatory, anticoagulant. So when we have a blood vessel that is thick, and thick, we look at this. This is the wall for the blood vessel. Every molecule has a wall, and before anything enters and interacts with the molecule, and it's a key, which is this kind of molecules that we see here. This kind of molecules are key to enter the biological molecules in our body. Now, if our blood vessels are swollen, it is difficult for them to travel around our body, and they have a congested circulation. This congestion will travel to our brain right here, and we'll have strokes, paralysis. That's when half of our body moves and half of our other body stays unmovable, right? So the question is whether to use these two at the same time. My answer, as a pharmacy technician in training to become a pharmacy doctor, it is consult with your doctor first. But this question was asked to me, and I told the patient, ask the doctor first. But then in my personal opinion, will be no. Why not? Because this Eliquis medication is a advanced medication. It's a novel medication. Before we used to have Quamidine, and Quamidine comes in very different doses. The doses of Quamidine needs to be leveled out every now and then. It needs to be checked with the doctor to figure out exactly the amount of anticoagulant that every person needs in order to function. But what is this medication? It's more common and it generalizes the use of people that have problems with their blood vessels in a more broad way. And now, as if you are being treated with Eliquis, which is a novel medication, it is one of the most popular. We also have a generic already, and it's very expensive for some people. Well, I use aspirin on top of it. I wouldn't use aspirin on top of Eliquis because this medication is already doing its function. And what's gonna happen if it's doing its function, that is untucking this wall? If we untuck this wall, then the blood becomes thin. And when it happens is that we have leakages. Now, we have a higher flow of blood because it is lighter. And when it becomes lighter, then if we hurt ourselves, we have an accident, then we have a what would you call this? A hemorrhage, right? This will be an hemorrhage. So to answer that question is no. Now the different question being, patient was claiming, everything is anonymous. I'm not gonna say any names or anything. Patient was saying he was taking this medication before. This is for a different heart problem, right? This is for heart rhythm. We have palpitations in our heart, and when they are not stable, when they are shocked, when they are stopped, when they have irregular, I will say, palpitation, we use different kind of medications. There are plenty of medications for arrhythmic problems. We have metoprolol tartrate, metoprolol succinate, nadolol, atenolol, esmolol, propanolol, carvedilol, bisoprolol. They're classified in different ways. Class 2 beta blockers, class 3 potassium channel blockers, and class 4 non-dihydropyridine calcium channel blockers. Excuse my language. English is my second language. So now, what I'm trying to explain is, when you go to the doctor, you have a heart problem, you got a stroke or whatever happened to you, the doctor doesn't know. The doctor in the emergency room has zero knowledge about what is in your body. So the person that cares about you, that knows your body, is your primary care doctor. And your primary care doctor is in charge of your helping. So it is common often to find different medications being prescribed when someone just gets out of the hospital. This can be taken as wrong for some people, and they're like, the doctor does not know what he's doing. The doctor, it's obviously just giving me everything that he can think of because does not know what is wrong with me. But this is not a good approach for the doctor to judge, because we are trying to save the life of the patient, and we are gonna try and see what is best for the patient. Obviously, analysis comes in after we save your life. After saving the patient's life, we go through a cardiogram, we go to scans, we go through all different kind of treatments that will tell us exactly what the patient needs. So that is the answer, and just wanted to do a brief explanation. Thank you all for listening, and see you next time.